proud to have my dearest sisters. Obviously, we're hanging out in the DMV, and you can say, for all of you who HU, obviously, if you've never been to be more careful about how you say it, and obviously Morgan State. But I've got Dr. Powell, Dr. Brown, and of course, we've got our dear friend and Dr. Williams will be coming soon. We want to talk about this vaccine. It is important for our community. I'm going to start with you, Dr. Brown, given that you are there administering at least 500 to 600 doses a day. What should we know about the vaccine and why? And introduce yourself so that people know that you are that sister with superpowers, and definitely what they need to understand that you're a professional, 4 degrees, count them, 1, 2, 3, 4, all right, and a mother who's a superstar and a graduate of HBCUs. What? Another superstar. So intergenerational superiority and excellence. So, my dearest, Dr. Brown, share who and what and has made this phenomenal sister that here is taking care of our community.
Well, Monson, thank you so much, my brother, for having me here. I'm very grateful to be here, very humble to be here, and grateful for the work that you all are doing with Hip Hop Rollout. I mean, your program's phenomenal. What you have, what you're bringing to the community is just exactly what we need. And so I'm just humbled to be a part of that. As you've mentioned, raised by a mom, single parent who was married, parents divorced, lived and raised on the campus of Norfolk State College in Norfolk, Virginia, with 4 siblings in the back of a classroom because my mom went back to school as a single parent. And so HBCUs are important to me. I work at Howard. I went to Oakwood College at that time in Huntsville, Alabama, from Norfolk, Virginia. And so I am HBCU born and bred and loving all things HBCU. So it's really important for me to talk about our community and the importance of the vaccines. You've mentioned that Howard is really doing a lot with that. We're doing research with the vaccine component in terms of what's actually out there. We are vaccinating probably 400 to 500 people per day, Monday through Friday, at our clinic. We're holding a clinic in the College of Medicine, which is really run and administered by the College of Medicine and the College of Nursing and Allied Health Sciences. It's an interdisciplinary program with dentistry, College of Dentistry and College of Pharmacy as well, really participating in this process. We've been going strong since January 15th. We're giving the Pfizer vaccine, which is 1 vaccine every 21 days, 2 vaccines total. And I want to really take away the misnomer that Black people don't want the vaccine, because let me tell you, every single day we turn away people who want to get the vaccine. So every day of the week, Monday through Friday, we have people, we call them vaccine vultures, who are standing outside of the clinic at the end of the day, 2 o'clock, 2:30, and they're being turned away because we run out of vaccine every single day. So that whole misnomer that Black people don't want to get the vaccine is simply not true. I will tell you very clearly that PWs, people white is what we call them, and the Asians are running to the door on Howard's campus. And there are people, and I got to get out my feelings, who have said, I've never been to Howard before. I've never been to the campus before. But now that we have vaccine, they're flooding the campus. So like, besides walking your dog, you're there to get vaccine because of course there's no charge for the vaccine. And every single day, the numbers are high in terms of Caucasians, Asians, African-Americans who simply come to the clinic to be vaccinated. Why is it important? And you were asking me before about the whole component. It's important because we're trying to get herd immunity. What's herd immunity? Is simply 70% of the population being vaccinated so that we can no longer spread this virus. We talked about this just minutely before the call, and I mean, before the start of the call, and that was the fear of getting the vaccine. And one of the producers talked about the fact that she had just gotten the vaccine. Let me tell you, I had to pray and ask Jesus to sit on the edge of my bed, talk to me, slap me with some water 3 times, wake me up to tell me to get the vaccine. Okay. And this was back in December. I was like, I don't know. Because, you know, the Tuskegee component is there in terms of that study from 1943 to 1973, when they didn't treat us for syphilis. We still got a little attitude about that. We're still a little, we're still a little attitude about that, considering Bill Clinton didn't apologize until 1997. And 1997 wasn't that long ago. So you have the Lucille Bard case and the other cases where we haven't been treated. And we got Ahmaud Arbery, who runs down the street and shot for jogging, for exercising. And we're not even gonna talk about George Floyd and the $27.2 million to be quiet to see if we can get Derek Chapin off of death row or whatever. That's $3 million per minute, in case you didn't do the math, of which 40% of that is going to go to the attorneys, but I digress. But when we talk about this whole health thing, what does it take in order for us to have herd immunity, to take care of each other? And so simply after I had that conversation with Jesus, I said, two things need to happen, Lord. First of all, I need to feel really comfortable about getting the vaccine. And number two, I really need you to give me an opportunity to get it, because it's not like you can just walk in some place and get the vaccine. Within 24 hours, I had a phone call from a colleague who said, come to this place, they're giving the vaccine tomorrow. I got it within 24 hours and felt extremely comfortable. And I chronicled on Facebook my 21-day journey of the vaccine. And I will tell you, people say, oh, after the second one, you get sick, you have a side effect. It's not a side effect at all. The easiest way to explain it is this. We wear protective hairstyles. Dr. Powell will bear me out on this when she comes on. I see Dr. Williams doesn't really have any hair, so I'm not even going to ask him to really talk about that. But when we wear these protective hairstyles, what happens is we braid our hair down in order for it to grow, in order for it to be protected. And then when we take our protective hairstyles off, we then have healthy hair underneath. The vaccine is simply that. We are covering our bodies, braiding it down, making sure it's safe, so that by the time we get that shot, that first shot, you slap it and the body doesn't know what's happening. But the second shot, the body's like, oh, okay, you bought it. I got you. And so the body is ready to protect itself, to really put that protective style on. Once it embeds itself into that RNA component and the body is used to it, those effects, they're not side effects. They're just part of the body accepting this vaccine. They go away. So 2 to 3 days, you have that flu-like symptom. And here's the other thing that our people don't understand. The healthier you are, the more likely you are to have those flu-like symptoms. So the stronger your immune system is, you're going to have that 2 to 3 day feeling poorly, having those cold effects. And then after 2 to 3 days, your body's going to bounce back and it's going to accept that protective style and it's going to be okay. So I'll stop there because I want my colleague, Dr. Powell, to kind of chime in on that. But the vaccine is simply a protective style for our bodies.
Super. What's up, Dr. Williams? Just want to shout out to my brother, who's always here from my dearest hip hop public health. But Dr. Powell, she has a whole audience. Hey, family.
I know, I can't see them.
We want to talk about this vaccine. Share with us before we watch this video. And really start talking, because everybody's dropping bars today. We know Doc's dropping bars. So
yeah, I love Dr. Brown. I love your analogy to the protective hairstyle, right? Like really helping folks understand what this means. And so as I thought about, I didn't have a come to Jesus moment, but I had a moment, right? I think, and I'm always transparent. A few years ago, like I was a person who did not get vaccines as an adult, right? And so it wasn't until I had kids that I really started thinking about it. And I was with my doctor and she was like, I'm scared to get the flu vaccine. It must have been at the time. And I was like, yeah, we can be scared and still do something. Like that's like a sign of bravery, right? And so as I think about now where we are with the COVID vaccine, I think the same way, right? Like we can be unsure, and still be brave and do the brave thing to help ourselves, help our communities, think about our kids, and I don't, I'm with everybody. I am with lots of folks. We were again talking before the call about it's kind of waiting and seeing, and we're gonna see how this all plays out. What's really going on with this vaccine, right? And so, and here we both are, having been vaccinated, and we talked on the call with others who have been vaccinated. So we are the people, right? We are the people who also had issues, and we've tried to do the brave thing, right? And so we're still sometimes unsure. Like I'm still like, I hope I did the right thing. But we do that all the time, right? We always make decisions and hope we did the right thing, and this is the right thing. So for anybody who's still thinking about like, I'm not sure, I think about all of the other decisions that you're sometimes unsure about. And like, don't let that unsure, like that feeling of uneasiness or fear stop you from acting, right? We can't be paralyzed by fear. We really need to think about, ourselves, our kids, our communities, because that's the only way we're going to get out of this, right? And so, yeah, I think that, in addition to what Dr. Brown was saying, like yes, there's absolutely the trust issue, but we also need to make sure we're acknowledging the equity issue, right? So there's this rush to get people vaccinated, but if the supply is not keeping up with the demand, I think we're still okay, right? Like if we're turning people away who want to get a vaccine, like all of those people who are in the wait and see category, by the time it's your turn, like you will have seen, right? Like you will have seen enough folks who documented that, like Dr. Brown did, documented their vaccine journey on Facebook or Instagram or Twitter. And you would have seen like we're okay, and we may still be unsure. So I don't think those have to be mutually exclusive ideas for us to be unsure or scared and get the vaccine. So I'll stop there.
Well, you're gonna have to start with where you are and where you got all this PhD from on next.
Oh, I'm sorry. Yeah, I'm so sorry. I forgot to introduce myself.
You're amongst family. It ain't no sorry.
No, you know what? I was feeling
go
kind
to
of
a
less than.
HBCU, show up
I
with
didn't
a
have my
basket.
HBCU like armor on.
It's okay. You can. Somebody got to go out there and do it. Somebody got to take the hit at the PWI.
I'm gonna represent for all the folks who went to Williams. If you're online, I got Williams College in Massachusetts. Go East. And then I got my undergraduate degree there, and then I went to DePaul University for both my master's and doctoral degrees. So shout out to DePaul, and also to Chicago. I'm from Chicago, born and raised. So similar to Gina, my mom was a single parent, but I never felt like it, right? I think we were raised by a community. We lived with my aunt. My aunt lived with us. My grandma lived with us. We were always a multi-generational household. And so when I think about, again, even the COVID vaccine, like I really do think about my family. I live in Baltimore now, but my family is in Alabama. My mom is in Mobile. My mom and her sisters in Mobile, Alabama. My sister and her family are in Chicago, close friends in Detroit and Memphis and Atlanta, LA, so New York, all of the major cities around the country, and we miss each other. We haven't seen each other in so long. And so again, when I think about like this decision to get the vaccine, it really is like, it feels like an act of bravery, right? Like I'm still unsure, and I'm hoping that I'm making the right decision for not just me, because I want to get back to normal. I miss happy hours in the gym, but I want to also like, make sure that, my kids are safe and that my family is safe, and that we can all meet up again and have a good time without worrying, like if somebody sneezes, are we gonna have like, are we at a super spreader event and we don't even know it, right? So, but yeah, so I've been all over. And I forgot, like I was also in Michigan, the University of Michigan. So shout out, go Blue, for all the folks. I did some postdoc work there, but always like I'm an adolescent health professional. If you can't see it, I work with kids a lot, and so I just envision a world where all youth are safe, healthy, hopeful, and connected. And the way we do that is really by like working with young people, hearing from them, but then also like empowering adults to make sure that we're there and we're providing like a support network for all those young people.
Dr. Williams, thank you. Dr. Powell.
How you doing, Munson? Good to be here, and good to be with you.
It's great to be with my brother, and clearly I've got two outstanding sisters to share with our community so that we can build our trust in health professionals, and clearly Black health professionals who clearly understand and are sharing their journey. What's going on? I know you've been over there saving lives and being a healer, and we've got video 5. So you let us know. It's your show.
No, I'm good. And thank you so much, Dr. Powell and Dr. Brown. It's just wonderful to have both of you on. Dr. Brown, you are an amazing person. I'm just so proud of all the wonderful things that you're doing over there at Howard, and Dr. Terry, you know how I feel about you, so we don't even have to go there, right? But I'm just grateful. I apologize for being late. It's been crazy. It's been really crazy. We're actually in the process of opening up another site in West Harlem here in New York City. We've been really working to get as many sites open as much as possible in the community, and that's going well. Convent Avenue Baptist Church, we had a pop-up site there. Before that, we had one at Abyssinian. And so we're just marching our way through the community, just trying to open up as many sites as possible, because access is a really big issue. And so I'm just excited, but I also want to say that there is good news, Munson. The recent survey showed that hesitancy among the African-American community, which was about 42% back in November, is now up to about 60%. Is now actually acceptance is increased by about more than 20 to 30%. And so we're seeing just over the last 3 months, a huge jump in acceptance within the African-American community. And I think, it's like everything, right? When you see your friends, your neighbors, your people you trust getting it, you're going to feel more comfortable, and you're going to get in line, and you're going to start getting it. And I'm just hoping and praying that trend continues, but it is very encouraging to see that trend. There are still, there are still areas that we need to work on. As I always say to individuals, the African-American community is not a monolithic community. It's a heterogeneous community. And we know from our experience with the flu vaccine, and we have a lot of experience with the flu vaccine. We know that there were, among the African-American community, if you look at data from the flu vaccine, there are, significant gender differences, socioeconomic status differences, and age differences in, flu vaccine coverage. So we are going to continue to see, variation across the spectrum of the African-American population, but this gives us an opportunity to really start targeting, micro-targeting, focusing our efforts. So we're not spreading that vaccine hesitancy message to those who are already converted. We take our message to those younger people, I call them the hip hop generation. Wendy Williams was just on with Dr. Oz, refusing to be vaccinated and saying that she will not be vaccinated. She doesn't trust it. And she's spreading that message, right? She's spreading that message of don't get this vaccine. And so we have challenges with the hip hop generation. And so we need to target our efforts to those people who really need that countering message of hope, of safety, of urgency, so that we can bring those young people online. Because, very soon, right now, we're vaccinating people with comorbidities. We vaccinated older people over 65, over 60 now, over 75 before, now with comorbidities. And as we start opening up to everyone, right, that we're going to get to a point where, demand supply is no longer the problem, because everyone who wanted it has gotten it. And then we're going to be dealing with these pockets of young folks that are not interested in getting it. And so the earlier we start targeting these groups and tailoring our message and tailoring our strategy to micro-targeting of these groups, we can really bring these young people on, so that when their time comes along, because look, folks in the church, you go to Convent Avenue, everybody wants the vaccine. You go to, we vaccinated over 1,000 people at Abyssinian. So older folks want the vaccine, but we have to start focusing on those younger populations, right? And that's why hip hop public health comes in. And that's where community immunity comes in. And so how about we check out that video, Munson?
Got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We can get back to normal, let me inform you, let's all get the vaccine. It's about community immunity. I'm talking unity for you and me. If Doc says it's good. Trust me, it's good. Now let's all get the vaccine.
Hip hop doc.
What it do, Dr. Mo?
It's a SOS. We gotta let the folks know.
They believe that the vaccine is bad for you.
But we looked at the data and it just ain't true.
When I got the shot, it kinda felt like the flu.
Shoot, that's much better than the ICU.
The shot's pretty safe, but the Rona is cruel.
It could make you sick, could be the end of you.
It's vaccine or bust, but there's a lot of mistrust.
Cause the system is racist, that's the main basis.
But face it, the numbers don't lie.
We gotta survive to save black and brown lives.
We need community immunity to fight from within.
We need 8 out of 10 to get it in for the win.
To protect and defend and hug your mom again.
Cover your grin, let the healing begin.
You dropping bars over there.
That video
go,
is
Munson.
fire. That video is fire.
There you go. There you
it.
go, Munson.
I understand. So I love what you said, but I think I've been riding your voice and vibing with you. I've been checking anybody that's talked about hesitancy in the vaccine. It's not hesitancy. I just want to be more informed. Most people need to be more informed. And I think that I pivoted when Dr. Williams told me to pivot last week in the conversation, because I don't want them, I say we hesitant because y'all put us at the back of the line again. Like at the end of the day, you didn't figure out you need to deliver it to me. You wanted me to go through some system that I did not control, that I couldn't get to hook up. You were making sure it was out of place for me, but in place for you. So I'm not even with the hesitancy conversation. And you got people waiting in line that really need to be already getting a vaccine. So for me, it was more of that. And I think we've got to even push back on the fact that they're pushing this hesitancy. No, yeah. I didn't get
Munson, the reason why we called it a vaccine literacy anthology and not a vaccine hesitancy anthology, because that's what's important. It's about getting the information through the right people to the right places. If you explain to people, if a credible messenger explains to an individual in any community that this vaccine is safe, forget Black, even white community, even Native American, Asian, if a credible messenger explains to any one of these folks on the ground who are a little skeptical and says, look, this vaccine is safe. I've had it myself. This is the reason why it's safe. And addresses their concerns, addresses their fears, fight these fears with facts. Those numbers are going to shoot up. And we're seeing that happen already, to the extent that people are saying, we want it, we can't get it, And that's what we're seeing on the ground. But we have to make sure we tailor those messages and we really culturally tailor that information. There's a way we speak to people that needs to be culturally tailored. And you have to make sure the message is coming from the right folks.
Yep.
That's one of the reasons why we had DMC in that video. And one of the reasons why we work with a lot of these artists and we work with a lot of these churches is because if a pastor says, hey, this is, I just had this, right? Congregation is going to say, if pastor's getting it, I'm going to get it. If the hip hop generation sees that their idols, DMC, et cetera, getting the shot, they're going to say, hey, you know what I'm saying? D just got the shot. Maybe it's okay. Well, I can go to them and give them a whole PowerPoint presentation with all the data, and they're just going to look at me and it's going to go in that way and come out that way. And they ain't not even going to hear it. It's that credibility, it's that trust.
Right.
Yeah, Dr. Williams, I actually think, I always, I'm always fascinated by the work that Hip Hop Public Health is doing. And I do think you're onto something, right? And so maybe one strategy would be to really think about who is a credible messenger, right? So for young people, maybe it's other young people or near peers, or maybe to your point, it's like hip hop artists. So instead of DMC,
Heart smiles, Terry. Right? Heart smiles.
Yeah. Do we need to get her on to get?
We
her
need
shot,
Joni. We need Joni up in here.
Or Cardi B.
Cardi B,
somebody who's really gonna
who's
gonna speak to.
You're right. Like somebody who people are like, oh, I didn't expect that.
If you got Wendy Williams,
Wendy Williams is doing. Wendy Williams is doing damage though, and that's the component that we have to look at: is how do we counteract the damage that somebody at Wendy Williams's level is actually doing? Do we find a Cardi B? Do we find somebody else? But here's the other thing, Dr. Williams, I think that you said that I would really agree with. it's not available. And the hoops that you have to go through in order to get the vaccine, are people just not going with that for several reasons. One,
No.
I live in PG County, which is predominantly Black, 900,000, one of the wealthiest Black people counties in the United States. And for you to get a vaccine in PG County, I received my vaccine in DC because I work in DC and they were vaccinating healthcare workers in DC. So I didn't have to go through the PG County loop. But for people who have to go through it, people who I know who have good credit are like, I'm not putting all my personal information in that portal. They're going to come looking for me. And the IRS is coming for something. Then somebody going to look, or my baby daddy going to come looking for something. We have suspicions, which are, don't play it. Because, my daddy paid child support and dropped off the $20 every month as each child got older. So by the time the fifth child it was $20. It was $100 for each child. So our people are very sensitive to those components of the man is looking for me, or I owe somebody, or something's going on, or I don't want you in my business, period, whether I owe somebody or not. I just don't want you in my business because I don't have a trust for the man, okay? So having said that, if we had communities that were open, and you just talked about churches, this summer we did, Howard did a COVID testing site. This is before people were coming out and they were afraid to be tested. Remember, everybody was like, oh, the testing got the mark of the beast, oh, I'm scared. So we opened up a COVID testing site, one at a church in Southeast DC, which is Ward 7 and 8, food deserts. Also, if you know about Southeast DC, it's like DC it's DC. Okay. I just stopped there for my Southeast brothers and sisters. Okay. We opened up a testing clinic. People who would not go to a hospital would come to the church. We had it at Pennsylvania Avenue Baptist Church. They would come in that church and be tested. Yep. They have to, all they had to show was ID. Just any type of ID, some form of whatever. We didn't take any insurance information. We just needed to make sure you were a person. We swabbed them, didn't do the nasopharyngeal that goes all the way back to the brain where they're trying to take a brain biopsy. Just a simple swab in the nose with a Q-tip that they could have. We had people who were 50, 60-year-old people who crying, afraid to have a COVID test, okay? And we show them the Q-tip. You just stick it in your nose, just like you clean your nose. Hopefully you're cleaning your nose. And we showed them how to do it. We started having people out the door because they trusted the church. They trusted the fact that we were in the community. They didn't have to give up any vital information. And so those numbers of testing rose so that we could actually test people. If the COVID vaccines were done in a laundromat, okay? And I took my kids on a field trip to a laundromat because they hadn't been to a laundromat. And I was like, you little Negroes gonna learn how to use a laundromat. They were traumatized. You're gonna get on a bus. We're gonna learn how to ride a bus. You
reminded me of my Saturdays growing up.
Listen, you go into the laundromat, you're gonna hang those clothes on the line. You're gonna learn how to survive, and you're gonna learn 3 ways to get home from school. But if we were to take COVID vaccines to a laundromat, to the church, all you gotta do is show up. Okay, no questions asked. You're going to get that card. I'm not going to ask you if you're an illegal immigrant. I'm not going to ask if you owe the IRS anything. I don't need, and I don't even understand this whole back thing of, you got to get it here. Every day, we should be opening up sites that are community sensitive. The barbershop, the hair shop, because we're going to get our hair did. Okay, the outside the gym. Okay, where people can walk up. Don't show any ID. We don't care who you are. We just want to get some herd immunity. We just want to get 80% of people having the vaccine so that the other 20%, like one of my best friends who will not take it, who's a dean of the HBCU, I had the president of Howard University call her because he said, I'll call anybody. I'll talk to anybody about the vaccine. He called her and the only thing he said that kind of tipped her, she still hasn't tipped over, was that getting the vaccine is less troublesome than dying. Okay. And, when you look at the stat of what's going to happen if you don't get it, but when I say, if we were to go to a laundromat, if we were to go to a hair salon, to the barbershop, to the church, no questions asked, get in line, open up at 6 a.m. We vaccinate until the vaccine is gone. We already have 100 million people vaccinated. If we didn't go through all these hoops of you got to check this off, you got to be this, it's got to be category 1C, you got to be 16 to 64, you got to have a comorbidity. Well, hell, if we all Black people got a comorbidity. If you're not overweight, you get something wrong. I'm stressed, whatever the comorbidity is. If all of those rules were out of the thing and we just vaccinated people until the vaccine was gone, half of this madness wouldn't be here. But you got to check the boxes.
Yeah, and we're getting there. I think that you're right. Like there's evidence that things like that work. I think even now about during the COVID epidemic when people were like when you can pick up food boxes, right? So you're right. We have to reduce the barriers to actually receiving the vaccine. I've read studies where people are going rather than having the elderly come, like they're going to the community centers, not necessarily the nursing homes, but the community centers for the or independent living centers. So reducing lowering the barriers to getting a vaccine is definitely important. And there's evidence that that works, right? So I think now it's like, how do we implement it? And I mean, we see that a lot. There's evidence that things work. It's really about how do we now make it work? Like, how do we implement it? Like, who do we need to talk to? So it sounds like both you and Dr. Williams were able to get a site set up in churches. I've worked with lots of churches here in Baltimore, and every time now and then I call them my pastor pals. I'll give them a text and I'm like, hey, like, are pastors in this group? Like all during the pandemic or when the vaccine came out. And like, I don't know who knows how to get a vaccine site set up. Like, what are the requirements? And so I agree, like we do need to lower the barriers, but we also need to make sure we're empowering the people who lead these organizations to be able to make those connections and do it well, right? Like we don't want anybody to get sick, right? Like, oh my goodness, like that's the worst thing that could happen, right? Like we need to figure out like, how do we connect the dots? Because you're right, I think that people will go there and that those facilities will be willing to be open to serve the community.
Yeah, it's interesting. That's brilliant. I mean, I agree with both of you completely, Gina and Terry. I was just on the phone with an organization, and all they specialize in is help community sites get set up as vaccination sites. So they provide all the logistics, all the support, all the know-how. They even work with the cold chain folks to bring in that refrigerator, all the stuff that they need to set up. This company, this is what they do. And they're out there. There are these organizations that are out there helping these community centers set up. But another thing that I think you guys both touched on is this decentralization that needs to occur, right? A lot of the initial batches, obviously, because of the storage for Pfizer and -70 or whatever, only certain places could really store that particular vaccine. And then there was a lot of centralization around the centers that could really store it and administer it. But now we have Johnson & Johnson, right, coming out, with much easier to store. And so now we really need to put a lot of energy into that decentralization, away from these like big giant places, whether it's a big academic center or it's a big stadium that's run by the state or the cities. We need to get into exactly what Gina said, into the barbershops, into the local pharmacies, into the churches, but we also need to help them with capacity. We need to match them to these organizations who help them with the logistics and with the setup and the know-how and the technical expertise so they can be set up right. And we know it works, and we've done it successfully with community sites, so we know it can be done. It's also critical. I think the other thing we cannot emphasize enough is the point Gina was making about barriers. Even setting up. One of my community health workers was telling us the other day, we have a whole army of community health workers, running around trying to help people get the vaccine. And one of them was telling me that she was working with a woman in the community on navigating the whole online platform and getting an appointment. And the woman got stuck. She didn't know how to create an account, because the requirement was to create an account with a password. And the whole, how do I create a password? The password thing just freaked her out with password. And you got to put a caps on here. You got to use a letter or a symbol. Even I have difficulty with some of these crazy passwords, right? And so she was like, and that's just one example, but there are 1,000 examples and barriers. And what happens is that people become demotivated. They feel like, they give up. And then, we're not even looking at attrition rates as a result of these barriers. And I'm sure those rates are also pretty high. We have to make it easy for people. but there's 1,000 excuses from everyone I speak to about why, we have to have safe controls. We have to have this. And I recognize that. But even in the presence of that, we should still make it easier for people.
What are those safe controls? Because one of the things, my best friend is a process management person. And one of the things that he says to me are eliminate things that are not necessary. So why do you need to know? It should be one of those, if you want to report it afterwards, if I'm on my way out the door, you want to take my stats of that I'm female, that I'm between the ages of 40 and 60, blah, blah, blah. But why is that necessary in order to give a vaccine?
Well, it's only necessary if you're a private hospital institution or an organization that wants to follow up with you or bring you under their patient care network, or somehow enroll you in their programs. Look, there are all types of motives for creating these barriers, but the reality is we don't need it. We don't need any of that. We just need you to come in, tell us who you are, how old you are, making sure, right now we're giving it to people of 16 and above, right? We don't want, someone who doesn't meet so just tell us how old you are, who you are, right, where you, that's it. Boom.
Are you between 16 and 64? And his thing is eliminate non-value added steps. What are those what are those non-value added steps that you don't have to have? Or if they're between the ages of 16 and 64, you can look at them and tell that. And what else do you need to know? Male or female on your way out the door, find it. But again, how do we as a people get to the Biden administration or whoever in order to
other things you need to know. You need to know about allergies. Yeah, you need to, allergies, you need to know that there are a couple of important things.
You can find out when they get there.
If you had a flu vaccine, you had a big allergic reaction, we need to know that. Right?
But they don't need to know that in order to get them. They need to know that when they sit in the chair. We can ask those questions when you get them in there. So all I need you to do is to come to the barbershop. We're going to be open from 6 to 10, get your vaccine. When they get to the chair, I had a man today who came in, sat in the chair, PW, and he had 2 comorbidities. One, he was diabetic. The second one, and if you looked at him, you wouldn't be able to tell anything. The second one was that he was on Coumadin, a blood thinner. And when he sat in the chair, he was on Coumadin, a blood thinner. He was diabetic. He had something else going on. I can't remember what it was. And he said to me, as he's sitting in the chair, as they're doing his card, he says, should I actually take the vaccine because I've been doing the blood clot. And I said, have you cleared this with your primary physician? And he said, no. And I said, I need you to do this. I need you to step to the side, call your primary physician's office. We'll hold your spot. We'll go ahead and see somebody else, get a clearance from him, and then you can come right back to the chair. Okay. This is a PW. All right. He goes, he steps to the side, he calls, 15, 20, 30 minutes later, whatever. He gets a clearance verbally. I don't need to know that. He sits back in the chair. The barriers that we have in place are ridiculous. They should not be. We should be able to take it to the corner restaurant with the block party. We should be able to, there's no reason that we shouldn't be able to go to the church, to the barbershop, to the hair salon, to the
we're in the process of setting up a mobile, whatever. We have a mobile van.
What's amazing is we had spring break and everybody wasn't in the airport. Like the things that just kind of like blow my mind are just like, we already know that there are millions of young people running through airports who are literally going and having experiences. I mean, you're at that age where you're working to have an experience. So to me, it's the intersection of hope and experiences that we want people to have. I really think it's about hope and experiences. I think the conversation is the hope of Dr. Williams and Hip Hop Public Health is you can find some hope and safety in what I'm saying, and you can receive the benefit of being able to be vaccinated, or if nothing else, checking and thinking about how you want to think about your health based on the fact that you like hip hop music. Now, outside of that, I'm not judging you, but I am going to address you. And I think that's half of what people do when they step to the mic. Can you address people where they are? Can we get in the experience of what people are traveling down? And so that seems to be the kind of missing link that has happened. But I'm worried, Dr. Powell, on the equity. I mean, like, how do we start out in such unequitable places as it relates to health service deliveries?
Yeah, I think that one of the things I just want to make a point about the last the point you made about meeting people where they are, right? And I've been telling this to anybody who here. We also need to figure out what message we are giving to the folks who still won't get it, right? If we get 8 out of 10, that means 2 out of 10 won't get the vaccine. And so one of the things I've been trying to do is really like listen, right? Like I work with young people a lot. So like listening, they always like, nobody's listening. Well, like here we are to listen and ask like, well, what's your plan? Like, what's your plan to stay safe? Like, okay, all right. We have, beat you over the head with every good strategy we've had. We have shown your friend, your mom, your cousin, your sister, we've shown you the numbers and you're like, nah, I'm good. So what's your plan? Right? Like, what is your plan to keep yourself safe and the people you love safe? So I think that, as we think about tailoring messages, we really need to think about those folks too.
How do they answer that, Terry? Terry, how do they
Yeah,
answer that question?
And you know what? The few people that I have asked, because again, like I'm in a network of most folks who do also, like Gina, like Dr. Brown said, like we want to get the vaccine as soon as we can. I have heard that, it is a very privileged space to be in, to be able to say like, well, and I'll be honest, I feel like I've been in it before. When I did not get the flu vaccine, it's like, well, I don't have kids. I can stay at home from work and when I feel sick, and I don't have to interact with people when I don't want to, right? And so I think that's people's response. It's like, well, I can keep me safe and I'm okay taking like measure. I have enough comfort and enough stability to be able to not interact when I don't need to interact. I can buy my groceries online. If I need a prescription filled, I can go through the e-portal to get my doctor to send it. We can do telehealth. I think we have created a space where people can, if you live this kind of, this privileged space, and I mean, literally, like, if anybody has kids on this call, like, or on this, like, they are like just a bucket of germs, just buckets, just buckets of germs. So like, it really is like one of those things that, if you have the space to pretty much quarantine anytime you want to, like, and that's really been the response from people who don't plan to get it. Like I can I can keep me safe and I'm okay not seeing people until I feel safe. So I think it's a place of privilege.
But I think you're the exception to the rule, because most of my Black people that I know, they're not staying in the house. They're not going to order their groceries online.
I agree.
And not going
That's
anywhere.
why I said all of my friends, most people I know are trying to get the vaccine because they're not in that space. I know very few people who are like doing both, right? Like, but I'm just saying the folks who I've talked to are like, I'm like, y'all gonna be good, so I'm gonna be good, and when I'm not good, I'm gonna stay home.
Yeah, but I had a different experience. A young lady wanted to get her dad. He has obviously a comorbidity. She hadn't reached out, to your network. And I think we really got to level set in terms of equity. I don't think anybody should wait their turn. If you know how, or if you need to make the necessary steps to make the connections and not feel bad. Like we already know we started from the back of the line. We already started with enough barriers. So if you're intelligent enough, I think we've got to encourage our community to step up and say, leverage yourself because you're helping everyone. This isn't about where you are in line at this point. This is about who's understanding what it is. So unfortunately, her dad didn't get the vaccine, couldn't catch him fast enough. And Saturday, he invited people over to the house. On Sunday, he feels sick. On Monday, he's tested and he has the virus. And so for me, I think there's still a conversation about how important this vaccine is. I think when you compare it to the flu vaccine, it gives people the wrong idea. Do you want to stay out of ICU? Say, number one, do you want to stay out of ICU? And then I'm going to stop there because I'm not a doctor. But I do want people to hear from Dr. Williams because this is not the flu vaccine. And you shouldn't say that this is the flu vaccine. This vaccine does things that the flu vaccine can't do for you. What are they, Dr. Williams?
Let me just keep it real with you. So look, man, Munson, I was on the front lines, and I worked in a hospital in Africa, right? In some of the hardest hospitals in Africa. I worked during the Liberian War, right? This was one of the bloodiest wars in Africa. So I've seen a lot, Munson. I've seen a lot as a physician. And I'm telling you that what I saw during the peak of the pandemic, I have never seen it before. We were coding patients, we got what we call a code in medicine where the patient goes into cardiopulmonary arrest and we have to resuscitate. We were coding patients left, right, and center. Left, right, and center. People were dying every single day, every day. And the process of resuscitating a patient, we are at risk because there's an aerosolized procedure when we're intubating these patients and we're chest compressing. So we were constantly, at risk. Our emergency departments were flooded. Look, Munson, I'm a neurologist and I'm not trained as an infectious disease doctor, but you know what they said to us? They said, everybody's got to be on the front line. So they trained me. I had to take these online courses and I had to run a COVID unit. I'm a neurologist. I had the entire floor was COVID. I had patients on ventilators. I mean, oh my God. I mean, I don't even want to talk about it because I still have PTSD from that experience, Munson. It was that deep. It was that real. So many people. I lost a friend of mine, Lorna Breen. Congress just named an act after Lorna. She was an emergency room physician. She committed suicide. She was right here with me at Columbia. She committed suicide. Lorna got sick. She went home. She got sick. We all got COVID. I got COVID. We all got COVID. All of us got COVID. I was really sick. We were all sick. Lorna got sick. She went home. As soon as we clear, we come right back to work. I was out for 2 weeks and I had to go right back to work. She got better. She went back to work. You know what happened? She committed suicide. Congress just named a section of the bill after Lorna Breen, one of the most beautiful women, incredible colleague. We worked together setting up stroke centers at Columbia. So what I'm telling you is that this is real. It's still dangerous. It's still killing people all the time. We have 758 patients with COVID right now, today, in our hospital, Munson. I had a friend of mine that called me to check on her brother. She said, Doc, can you go into the ICU? We can't get any information because we're not really allowed to go into the ICU. And can you check on my brother? I went in to check on her brother. He was dying. Look, man, Munson, this is real. All I'm telling you is that this is real. And I'm tired. As a physician, I was texting Lori earlier. I just came off service. I was literally just on service, which means I was running the units. I'm tired. And I'm tired because it's endless. And now we have a way out, Munson. We have a way out. We have vaccines. We can get out of this darkness. We can come out into the light. And so for me, this is deep because what you do affects me. But even if you don't care about me, if you don't care about the doctors like us and nurses, care about your grandparents, care about your loved ones, because you know what? People are still spreading it like wildfire. And I say to my young people, they often tend to be asymptomatic. They're spreading it all over the place. Look, 1,500 people are still dying in the United States a day, right? This is still serious, Munson. And people need to understand. And if I have to get down on my knees and beg someone to get the vaccine, look, I ain't too proud to beg, Munson.
I ain't too proud to beg.
I'm keeping it real.
All right with the TLC. All right, I'm here.
Where's hip hop public health right here?
Yeah, I want to ask Dr. Williams 2 questions that I think we need to just make sure we cover because I think this is one of the things. One are the few people who have the type of comorbidity, and you as a neurologist would really be able to answer this. that would say, okay, my doctor's going to say, no, I shouldn't take the vaccine? Because that number, those processes are very, very small. That's one. And number two is what can we do in order to remove those barriers from just this? You're setting up these clinics that our people, a committee of one can do to remove these barriers to try to get this out of the places that are hard, that we're not going to go to, that we don't have to go online to fill out all of this, to really be to just give it to whoever wants it.
Yeah, well, a couple of things. I think first of all, with regards to the what we call the contraindications to COVID vaccine, the main contraindication to COVID vaccine is when you've had a severe allergic reaction in the past to. That's really the main one. And when I say severe, it means anaphylaxis. Other than that, there's some relative what we call relative situations where we have to be a little bit cautious, and you need to run it by your physician. And some of those include individuals who are severely immunocompromised, right? Those with severe immunocompromise. You can be immunocompromised when you're getting chemotherapy, certain chemotherapy regimens, when you have severe, hematological, oncological cancers and diseases. In those situations, you definitely need to speak to your physicians, because we know that there were some HIV patients in the trials and they did well. But there's certain conditions that you do need to have this conversation with your physician. But by and large, these are incredibly safe vaccines that are really, the trials really did a good job in including a lot of people with a whole host of comorbidities. I always tell people, if you have a comorbidity, you're more likely to die from COVID if you get COVID than die from that comorbidity, because these comorbidities put you at risk for severe COVID. Those are the folks we see in the ICUs, Gina, are the people with severe heart disease, with severe diabetes, severely obese, poorly controlled. These are those who have really bad comorbidities. And that's why we recommend that anyone who has these, don't think you really need to get it. So have the conversation with your physician and make sure that you can get it. All my stroke patients, I tell all of them, go get the vaccine quickly go get the vaccine. Because at the end of the day, one of my stroke patients said, well, what about the blood clots? Can it get caused blood clots? And I say to him, I say to my patients, no, no, you're more likely to have severe COVID, than you are then by not getting the vaccine, than you are by getting the vaccine, because vaccine is going to protect you from COVID entirely. And so, I just want to say something really quickly. Now, there was a recent scare about the AstraZeneca vaccine. There have been these reports in Europe about these blood clots that are occurring in some people who reportedly received the AstraZeneca vaccine. But we know that almost 20 million people have received the vaccine. And if you look at the numbers that we're talking about, it's tiny. In fact, it's less than the numbers of people who got these blood clots are in the vaccine group are actually less than what would be expected in the normal population, right? And so people, there was another issue in Norway where a bunch of people in nursing homes got sick. Some of them died, and they received the vaccine. The reality is the death rate among those nursing home residents with all their end-stage conditions, they had a really high death rate of baseline. And so it's so easy for people, if you get the vaccine and have a natural event occur, for you to say it was the vaccine, it was the vaccine. But it wasn't the vaccine, because you can't make these causal claims because you have to analyze the data properly. And so to answer people's questions, almost everyone is eligible for the vaccines that are currently approved in the United States, with very, very, very few exceptions. The main exception is those tiny percent of people who do have these severe reactions. But even if you do have these severe comorbidity, even among immunocompromised, it still merits a conversation with your physician.
And I just want to respond to Dr. Brown, your question about the reducing the barriers to folks being able to get it. And that goes back to the question you asked me earlier, Munson, and I don't think I answered about equity, right? Like, I think that's what we do. Like, equity is like health equity. The idea is really, the way we measure it is making sure that folks who are not able to get optimal health can get optimal health, right? So if we're not able to reach the folks who have comorbidities, we know, like Black and brown people, we got a lot of comorbidities, right? And so why aren't we in communities, right? Like, why haven't we made that process easier and created funds so that the local organizations who feel comfortable and feel equipped to be able to handle whatever the protocols need to be, why haven't we like made this possible and easier for them? So I think that in thinking about equity and how we think about it, we really need to be thinking about how do we make sure the folks, again, who are not getting optimal health right now. So the folks who are dying, like Black and brown people are dying at higher rates, our hospitalization rates. And when you think about rate, it's like, the raw number doesn't tell the story well, because like, Black people, we're not enough of the population to tip the whole scale over, right? But when you look at proportions, like the proportion of people who are going to the hospital and dying of COVID, like we are bearing that burden all over this country.
The majority of that 500,000 people, 510,000 are us.
We are bearing that burden.
We're the largest number of that group.
Absolutely. And so as we think about equity, we really need to think about, well, how do we do that better? If we know already, right? Like we've been talking on this call, like things we already know, right? Like we know what the numbers are telling us. We know who's died. We know who's contracted COVID and had, hospitalizations or been on ventilations and also are having like long COVID, right? We know who those people are. How do we make sure those communities are now prioritized, right? Like I get it. I am full on board when we said we needed to, first vaccinate hospital personnel. We also now need to use the data that we have, right? Like we are collecting all this data. Like, how do we now figure out where people are so that we can get vaccines to them? This should not be a hard process. We shouldn't, like Dr. Brown said, we shouldn't have to answer pretty much like, write an essay or answer like a 30 item like like a 30 item survey, like the IRS tax forms to get a vaccination. Like that's
if they don't remove those barriers, the majority of our people will not be vaccinated. We're not giving you those vital statistics of information that you want to know in order for you to track us down. That's why our census numbers are significantly lower, because we're not.
Right. We don't tell you who is in our house.
We're not going to tell you who's in our house because my auntie from my brother is hiding. No, we're not doing that. So when people start to understand our community and what we're all about, decrease those barriers, ask the necessary questions, look at the evidence base of what we need to know. I need to know your name, whatever name you're going to give me. Okay. I need to know if you have comorbidities so that I can treat you. I need to know if you're going to have an anaphylactic component of that you have cancer, whatever. We can ask those questions at the door. That can be done at the door. I don't need you to go online, put in a passcode, set up an account, put your mother's maiden name in, put in your social. I don't need to know any of that.
Or even have an email address, right? Like, so our mass vaccination system here, like you have to have an email address.
Not giving.
People don't use email.
I have friends that are legal and they will not give you their email address. So people don't want you in their business. We don't trust you. We don't know what you're going to do with our information. We don't want your cookies. Okay. We don't want you calling us. We don't want it. And so if we just remove the barriers, ask the necessary questions and get down to the component of the things that are necessary that can be asked as they get there, open the doors, vaccinate in our communities where we're getting our people. Half of this, our herd immunity would be so secondary.
Yeah.
Well, I want
Dr.
to
Williams
thank
said
everybody.
earlier, decentralization.
But I want to thank everybody because it's real important. I want to thank you, Dr. Powell. Clearly, equity is an issue. Dr. Brown, you didn't drop any rhymes for me this
I
time.
got your bars. I got your bars. I got your bars. The vaccine is what's up. Soon you'll see this, that sore arm is just not normality. Let's see. So get your vaccine and watch us be a group full of Black people with herd immunity. There you go. Drop the bars.
All right.
There you go. So,
All right.
next time, give me a heads up and I'll have a little better one, but at least we got a little something going.
Now, well, Dr. Williams, always great to see you. Dr. Powell, great job, Dr. Brown. We want to thank you all for tuning in to Health IQ and for the whole community. Let's love ourselves by taking care of ourselves and getting the information necessary for you to make a decision on getting that vaccine sooner than later so you won't see the ICU. This is rolling out on Health IQ. Peace.